there was excellent insight into libido at midlife. We learned about spontaneous desire versus responsive desire. And this aligns with what I've often told patients. You shouldn't expect to sit around anymore all day thinking about sex. However, you should look at it from a neutral standpoint, like something that you're going to do in the future when the opportunity arises. You'll enjoy it based on your connection to your partner and on past experiences. But of course, this can also only happen once you have resolved any vaginal dryness or discomfort, and that you're not feeling, depressed or disconnected or sleep deprived. The final section of talks for the day was all about the brain-body connection in perimenopause. Dr. Pauline Mackey gave a fascinating talk about the current evidence around hormone therapy, menopause, and dementia. The takeaway here is that in young surgical menopause patients, estrogen alone does appear to prevent cognitive decline. However, the impact in naturally menopausal women is neutral. The wonderful news is that for women with moderate to severe vasomotor symptoms, treating the vasomotor symptoms did have a positive impact on cognition in the future, and this benefit was consistent regardless of the method used to control the vasomotor symptoms. So for anyone out there who chooses not to or cannot use hormone therapy, rest assured there are many other great options for managing VMS, especially now. And if you fear missing out because of the potential cognitive benefits, you have nothing to fear. Dr. Rebecca Thurston gave an amazing and sobering talk about the connection between trauma and menopause symptoms. Women who experience childhood abuse or trauma are more likely to experience more frequent vasomotor symptoms and insomnia, with the increase being most prevalent for victims of childhood sexual abuse. Childhood abuse was also strongly linked to increased cardiovascular disease in older women, and endothelial dysfunction, that's the inner lining of the arteries, was proportional to the number of traumatic incidents in childhood. The body truly does keep the score. Finally, Dr. Jennifer Gordon spoke on the connection between depression and the menopause transition. She highlighted the impact on estrogen fluctuations on a woman's sensitivity to stressors, which might manifest as their reaction to anxiety, anger, fear, rejection, etc. So not the level of estrogen itself, but the variability of the levels for that woman over time appears to have an impact on anxiety and mood. But as per usual, more research is needed in this area to better understand and manage this connection. So, fabulous day. This was a very long talk, but thank you for listening. I hope you got something new and exciting out of it. I can't wait to talk to you and see you tomorrow. Have a great night.